Millions of Americans live with Alzheimer's disease or other dementias today. Research shows Black adults have a higher risk of Alzheimer's disease but are underrepresented in clinical research trials aimed at bringing an end to this disease. So Dr. Crystal Glover with the Rush Alzheimer's Disease Center in Chicago is joining us live to tell us what the AHEAD study is working to accomplish. Good morning, Dr. Crystal Glover.
Good morning, Melanie. Thanks for having me today.
Thank you for being here to talk with us about this. So I'm curious to know why Black men and women are more predisposed to having disease like heart disease and Alzheimer's, and if research has come that far to understand why certain ethnicities are predisposed to those kind of ailments.
Thank you for that question. Overall, the two biggest risk factors for developing Alzheimer's disease for anyone is older age and genetic predisposition. However, for African Americans and Blacks, being at higher risk is really starting in midlife. So research shows that we really need to take care of the heart to head highway. What that means is taking care of hypertension, type 2 diabetes mellitus, and then total high cholesterol are key in taking care of your brain in later life. So the first step is to go to your primary care provider to understand, do you have these ailments? Then be able to take control of those through diet, medication, exercise, and be consistent in controlling those issues. So really taking care of the heart is taking care of the head.
And Dr. Glover, why are Black adults so underrepresented in clinical research? And is there anything being done to bridge the gap when it comes to Alzheimer's studies?
So we have a big history of mistreatment of Blacks, African Americans, and a whole host of other groups in clinical research. So that is the history there. However, studies like ours, the AHEAD study, are looking to get ahead of Alzheimer's disease. So starting from the ground up with really thinking about how we can understand, respect, and address brain health of African Americans and Blacks from the onset. So please go to aheadstudy.org to see exactly what this study is about. We're really getting ahead of that by understanding among these communities first.
And have there been any recent breakthroughs in clinical research that were in this step or the right direction in helping treat this, or maybe even one day at curing Alzheimer's disease?
Indeed, the AHEAD study is aiming to do just that with an investigational treatment. The key thing about this study is that they're looking to enroll individuals as young as 55 years of age all the way to 80 years of age. That's important because by the time we start seeing symptoms of Alzheimer's in our 70s, those brain changes had already begun up to 20 years before. So starting with younger people, particularly African Americans and Black adults, can allow us to prevent or delay this devastating illness early on.
I love it. Thank you so much for clearing up all of our questions. I think that was very fascinating and an in-depth look at how Black adults are being represented when it comes to this disease. Thank you so much, Dr. Crystal Glover.